Hello there, it's Dr. Jim. Thank you for stopping by for another good topic. This one is something that I've talked about years ago and kind of put it away in a drawer and haven't talked about it for a long time, but it's something that is controversial. It's a topic that different states throughout the country are looking at, and of course, different countries around the world are looking at this topic area and have different thoughts and opinions on it. It is physician-assisted suicide. When's the last time you heard about that? When's the last time anybody talked about it? It's been a while, right? So my question is, anytime I think about physician-assisted suicide, is it right or is it wrong? I always go straight to the ethics. Who's it good for? Who is it not good for? Are we playing God? Are we not playing God? So on and so forth. So, one of the most controversial topics in the world of healthcare and medicine is the act of dying under the supervision of a physician. Some people have very strong thoughts and opinions on this topic. There are those who support the right to die, and there are those who are opposed to it. And both sides, they have several reasons, and they're rather logical why they feel this way. So what is physician-assisted suicide? Let me lay down the framework, and then we'll talk about it, whether it's right or wrong, the good or the bad. According to, I go to the experts, the American Medical Association, physician-assisted suicide takes place when a physician provides, quote, the necessary means and or information, end of quote, to facilitate a person's choice to end his or her life. Other terms for this act include death with dignity, doctor-prescribed death, the right to die, and physician-assisted death. These terms, interestingly, do not contain one word. What is it? Suicide, making them less associated with suicide or even the connotation of the term. I just find that an interesting thing. And stressing the focus rather not on suicide, but the medical practice, the medical act, or the event. Interesting. So is it like another term that we've heard about for many years, euthanasia? What's the difference between the two? In the United States, physician-assisted suicide, or the right to die, has always been carefully differentiated from euthanasia, which actually may be regarded as mercy killing. Euthanasia involves the administration of a lethal medication to an incurable and suffering individual. Incurable, horrible suffering. Euthanasia can be voluntary, and the person requests it, but it can also be involuntary. It's illegal in the United States, but it is legal in countries like Belgium, Colombia, Luxembourg, and our neighbors to the north, Canada. It has also been decriminalized in the Netherlands, although I think a lot of things have been decriminalized in the Netherlands, right? Now let's look at arguments for physician-assisted suicide. In general, there are three strong and common arguments supporting the practice of physician-assisted suicide. They are respect for the individual's autonomy, relief of suffering, and that it's a safe medical practice under the supervision of a medical professional. Now, ethically speaking, think critically and ethically with me here. It seems hard to argue with any of those reasons. Respect for the person's autonomy, relief of suffering, it's safe. If a person lives the way he or she wants to live, and I'm a strong advocate for that, I'm going to live the way I want to. Shouldn't we be allowed to die the way we want to? Just playing devil's advocate here. If animals are put out of their suffering, you've heard that argument, right? Shouldn't humans have the right to decide to end their suffering? Since the person is dying and the practice is safe, why not? Here are arguments against physician-assisted suicide. Just as individuals have very strong attitudes and opinions for the act of suicide by physician, there are those who intensely oppose it. Themes among those against it include suicide contagion, which I'll describe, the slippery slope, we've all heard that one, and the role of depression in advanced illness. Suicide contagion is interesting. I remember this from way back in college. It's a term coined by the sociologist David Phillips, and he was referring to high-profile suicides that cause or motivate a spike in suicides, especially among individuals who have very similar characteristics, very similar circumstances. Example, if an individual with Huntington's disease or ALS, they decide to end their lives and they get a lot of media attention, there is the chance that similar individuals are going to do the same thing. That is suicide contagion. So if this type of dying is appropriate for cancer, slippery slope, shouldn't it be all right for other diseases, for other reasons? See, that's the slippery slope. If this type of individual with this set of diagnoses and this level of suffering, it's okay for them to die under the supervision of a doctor. What about this diagnosis and that diagnosis and these circumstances? Isn't losing one's autonomy being a burden, a lack of joy in living, loss of dignity? Aren't these all good reasons to die by the hands of a doctor and a trusted medical team? And what about being so depressed that one simply does not wish to go on living? I mean, think about how many disorders depression accompanies. It doesn't have to accompany any disorder. It can be simply severe, clinical, major depression. Is that enough to qualify for death by physician? Aren't these all ethically sound reasons to die? Here's my takeaway. One of the most troubling and controversial issues in medicine today is physician-assisted suicide. It doesn't matter what we call it. If you dig into this literature, which I have, this is grueling for doctors and healthcare teams. It's a terrible topic for them. Since its beginning, there are those who have strongly supported physician-assisted suicide, and there are those who are against it. And for very sound and ethical reasons. I mean, is anything that I just discussed out of bounds, out of reason? Is it moonbat stuff? It's not. It's logical. The ethics involved in physician-assisted suicide are complicated. Who is right? Who is wrong? Well, only time and circumstance will tell. Hopefully, none of us will come down to the point where this is an option. I'm Dr. Jim. Keep your options open for living well. Keep coming back. I want to keep poking people with critical areas to think about. So come back for more critical thinking with me, Dr. Jim Collins. See you soon.